Thanks for staying with us. Incontinence. It's probably not your average dinner party conversation, and it can be very embarrassing at times, but it is also very real and very common. So it's very important we talk about it. And here to give us the facts, we welcome urologist, advocate for holistic wellness, and author Suelyn Hall. Dr. Hall, thank you so much for being here.
Thanks for having me.
Well, this is really important because I think that says it all. You know, we all might be experiencing it, yes, but we probably don't ask anyone about it. Yeah, yes, exactly. I think it's a good place to start with just explaining what incontinence actually is.
Yes. So as a board-certified urologist for the last 20 years, none of my patients want to have any leakage of urine, which is what urinary incontinence is. And any unexpected loss of urine is just not accepted.
Sure.
You know, it's just a fear. But there are three different levels. Some you don't have to see a physician, and some you should. So for mild urinary incontinence, basically you'll have just a little drop of urine, and basically the drop of urine is just enough to, you know, have a panty liner get a little wet.
And know that it's happening.
And know that it's happening. With that, you most times can have Kegel exercises can help quite a bit. Or if you're doing in the gym, you can do pelvic tilts or squats, slow squats, step-ups with weights, and like a bird dog, and then that will help basically strengthen your pelvic floor tone.
Really? And so those actually help in doing all that?
Yes.
Okay, that's good to know that we can at least help prevent it and try and fix it a little bit.
Right.
What about the next level?
So the next level is usually a good amount of urine, about 2 or 3 tablespoons full.
That's quite a bit.
That's quite a bit. And so people have to change their clothes frequently, and they get more embarrassed. So that's a time when I would say see a urologist like myself, where we can do pelvic floor muscle rehabilitation or neuromuscular electrical stimulation, where we put a probe in the vagina, or in women, and in men we put perineal electrodes and tighten basically a forced contraction, a forced Kegel, and that will help control the pelvic floor.
So is that what's happening during incontinence? Those muscles are just weakened so much?
Yes.
Do we know it's happening, or that it's going to happen?
Here's the bladder, and here's a bladder neck. There's usually just like a little bit of a leak that occurs through there, and by doing the Kegel exercises, we're tightening and preventing pelvic floor relaxation. So we're teaching the pelvic floor to tighten to prevent the urine from leaking out.
Okay, that makes sense. Now, that seems like quite a bit of urine to me, and it definitely cause for concern. What about the third level?
So the third level, which is the severe incontinence, which is just a constant leak. People wet their clothing, they get embarrassed. They usually see a urologist.
Sure.
And basically what we do in this field of large volume loss, a significant amount, we can either do injection at the bladder neck, where we can bulk up the urethra with tissue, collagen even, to close and increase resistance. Or we can take a piece of tissue from your pelvic floor here and put underneath the bladder neck right here, and that provides a sling to the bladder neck for women who leak urine. Or for men, we put an artificial sphincter where we wrap around the bladder neck at the urethral border and actually put a sphincter there, and we put in the scrotum a bulb that can turn on and off, so you can actually open and close the bladder neck and prevent leaking.
I think it's important that you're talking about all of this so that it's not a hopeless matter that we're having something like this happen, because obviously it's very embarrassing, and you don't know when it's going to happen, and out in public you have to deal with all of those repercussions. When do you most see people, like what ages, that come in and do this?
Women that have children, by pushing through the canal, natural vaginal delivery, their pelvic floor muscles just naturally loosen. But when they get older, it doesn't usually happen when they're young because their muscles are strong. But as we get older and our muscles relax, that's when we start seeing the incontinence. In men, when we do radical prostate for prostate cancer surgery, they oftentimes have decreased flow to the muscles right there, and the muscles basically start leaking, and men don't tolerate leaking at all very well.
Not at all. It's so embarrassing.
It's so embarrassing, and so we do usually do an artificial sphincter for those men who leak after a radical prostatectomy.
But the best thing is to come in and talk to you.
Yes.
When should we come in and you know, we probably don't often go visit a urologist.
Right.
When is the right time that's like, okay, now I'm going to do this? Is it at this level, this
Probably
level?
at this level when you're just having a little bit of leaking and you want to learn about pelvic floor muscle control. At this level, when you're really leaking a lot, we have some local anesthetic procedures that we're able to do in the office to tighten the bladder neck and increase bulking, kind of puff up the bladder neck.
Sure.
And then, of course, when it's this embarrassing, we really do need surgical intervention.
Come in immediately.
Yes.
Now, you mentioned those exercises that we can be doing in the gym. What do we have over here?
Yes.
I see a salad. Where does this come into play?
So we need to drink a lot of water because when the urine is more concentrated, it makes the bladder spasm. So the more water we drink, the more dilute the urine is, and you leak less, actually.
Wow.
And then when we drink caffeinated beverages, they cause the bladder to spasm. And when the bladder spasms, we leak more.
Okay.
So cutting back on this and eating healthy
helps make a difference.
helps make a difference.
I love that you tell us drink more water because
Yes.
it sounds counterproductive that we would have to get up more and use the bathroom, especially at night. But
Yes.
these sugary drinks,
The sugary drinks are the worst.
as
They
if we
really
needed
cause
another reason to cut it out, right?
We do need to cut out sugar, and we do need to cut out things that create spasm. Water, fantastic. Now, if you start getting older and your bladder is not holding as much, decreasing 2 hours before bedtime really helps prevent the leaking
That's
and
a
getting
great
up at
tip.
night as well.
And I think best thing is go and talk to your doctor.
Yes.
Thank you so much. Seeing it actually happen really just emphasizes those different levels and that it's best to start early, but hey, it's never too late.
Never too late.
Thank
We're
you
here
so
to
much.
fix this.
And you're
Thank
sticking
you.
around with us, so
Yes.
we will share Dr. Hall's tips on Bloom Tampa Bay. But after the break, we're going to hear a little bit more about your story. We'll be right back.
High energy bills?